All right. Good afternoon, everyone. Welcome to our NMQF Friday webinar. Give folks about another 10, 15 seconds to start logging in. I'm Brandon Garrett. I'm the CEO of the National Minority Quality Forum. Today's topic is going to be on food as medicine. During our annual summit on health disparities and spring brain trust, this was one of our sessions, and it was I was telling the audience, telling folks here that if they remember, it was a standing room only program, and so we wanted to make sure we imparted that knowledge on everyone here. Before we start, I just wanted some housekeeping items. One, if you have a question that you would like Dr. Perkins to ask to our panelists, please put it in the Q&A box below. And if there are some just discussion points or topics you want to go ahead and just make the audience aware of, use that chat, the webinar chat function. As I said, I may have known Dr. Latasha Celebi Perkins will be our moderator today. She is a family physician at Georgetown University Medical Center. She's also in our first class of NMQF's 40 Under 40. She helped edit Congresswoman Kelly's the Kelly report on health disparities that we did back in 2014. And she's also a member of the NMQF advisory board, along with being a wife and mom and all those things too. She is like me, she is from the Gulf Coast, her being from Biloxi area, or Gulfport, sorry. And me being from New Orleans, but without further ado, I want to turn it over to Dr. Latasha Celebi Perkins to lead our webinar.
Hi, family. Welcome. Thank you for coming and joining us on this beautiful Friday afternoon in June. So Brandon's telling all my age, first 40 under 40, naming years, but all of that expertise is under the realm of health equity. And so I'm so excited for us to talk about food as medicine today, to get us on the same playing field, to help introduce the theme. I want to tell you just kind of what Dr. Robin Kelly stated, that nutrition has a profound impact on our overall well-being and how our bodies respond to illness and disease. Medical nutrition therapy is a proven method of managing and alleviating symptoms of many chronic illnesses and diseases, and is essential. It's essential that Congress ensures affordable access to this treatment, which I really care about as a physician, a practicing physician. Expanding access to nutritional therapy is particularly crucial in our ongoing efforts to eliminate health disparities, as many minority and underserved populations have long experienced adverse health outcomes due to limited access to healthcare, healthy foods, and opportunities for exercise. Unfortunately, a lack of coverage and knowledge of medical nutrition programs has discouraged many individuals from seeking out this treatment. So I'm so happy that you joined us today to discuss this idea of food as medicine. For medical nutrition therapy is an effective strategy to improve disease management and prevention. And I am ecstatic about this concept as a physician. And so we'll go ahead and introduce our amazing panelists today. I have them introduce themselves and what organization that they are with. Laura, you can go first.
Awesome. Hi. It is great to be back with the National Minority Quality Forum to talk about food as medicine. My name is Laura Carroll. I am a senior advisor for nutrition outreach at FDA Center for Food Safety and Applied Nutrition. So my day-to-day job focuses on engaging with our stakeholders on our nutrition priority issues, hear feedback, identify areas of synergy so that we can help advance shared goals together. I've been in federal government for about 10 years, had time at the White House as well as USDA. FDA has some unique levers in the nutrition space. When people think about FDA, they often think about food safety, which is great because we do have one of the safest food supplies in the world, but we also have some really powerful things that we're doing in the nutrition space. So excited to be here today to share a little bit about that and how it influences food as medicine initiatives.
We're so happy to have you here today as well. So we'll next go to Minerva.
First, thank you so much for the invitation. Really appreciate being here with these colleagues today. I'm Minerva Delgado. I'm the Director of Coalitions and Advocacy at Alliance to End Hunger. Alliance to End Hunger is a national nonprofit, and we are an alliance. We are a multi-sector coalition with over 100 members that are in the nonprofit, corporate, foundation, university, and faith network spaces. And as my title says, I oversee all of our advocacy work, bringing our members together to decide on what they will advocate for as Alliance to End Hunger, as well as our coalition work with over 50 partners in 30 states across the country who are doing hunger relief and anti-hunger work. And so the Alliance is a group that advocates together. We're also a group that is a thought leader, convener, and connector throughout our network around issues of food and nutrition.
Thank you, Minerva. William?
Hey, everyone. Thanks for having me. My name is William Dwyer. I'm a legislative assistant with Congresswoman Robin Kelly, covering a number of issues, but relevant to this, I do a lot of our work on agriculture and food, and then on the nutrition space, myself and my health colleagues work together on issues related to food as medicine and the Medical Nutrition Therapy Act. I've been on the Congresswoman's team a little over 5.5 years. I'm originally from the south suburbs of Chicago, and so I actually got started in our district office back in Illinois and came out to DC in 2020, and I've been on the team ever since out here. Really excited for the conversation today.
Bottom line, our panelists know what they're talking about. They are in this work, they do this every day. And so we're going to dig in and find out more about what they're doing in this actual space. And so again, I'll come to you first, Laura. So what is the FDA doing to further food as medicine?
Thanks for the question. So I'm just going to start by zooming out a little bit in case folks aren't aware of some of the work that we do in the nutrition space. We have regulatory responsibility for about 80% of the food supply. The rest lies with USDA, but we have two key avenues where we influence nutrition. One is to help provide consumers with more information on food packages so they can make healthier choices. Example of that is with the nutrition facts label. We recently updated that. It now includes information about added sugars. But we also, our other key avenue is to help improve the underlying food supply so that the food available in grocery stores and other places is healthier by default. One of the examples we can share on that is when we required the declaration of trans fat on the nutrition facts label in 2006, we saw an 80% reduction in the intake of artificial trans fat. And that was due to people choosing different products, but also it motivated industry to reformulate their products. So how does this all influence food as medicine? We really are providing opportunities at a macro level with supporting food as medicine, having those healthier foods available for people and making the choices easier. One of our highest priorities right now is finalizing updated criteria for the claim healthy, which can appear on packaged foods. We are working to finalize the updated criteria. It would now focus on food groups and nutrients to limit, like sodium, added sugars, and saturated fat. What this means for consumers and industry is that they could see the claim healthy on food packages and help them pick out foods that really do fit within the dietary guidelines for Americans. And then, of course, it could help motivate industry to reformulate their products to be able to use the claim. This can then become a really instrumental part of food as medicine efforts. A lot of retailers are starting to do more in the food as medicine space, including in-store signage and education for consumers so they could incorporate the healthy claim into that. A lot of registered dietitians are now also in stores, so they can be a huge huge contribution to helping consumers identify those healthier products. Online grocery retailers could also include tags or filters for the healthy claim. So that is just one example of one way that our work supports food as medicine, but we also have tons going on in other spaces, but I'm going to stop there for now.
No, that's amazing because it brings the food as medicine into the daily lives of everyone. And as a physician, I am so excited about this because my patients definitely read the labels when it comes to their medicine, but not so much with food. So this is encouraging folks to think of food as medicine as well, as a way to treat your body. So you need to be really knowing what's going in. And that's interesting that you said that, like, your mind knows what the mind sees, what the mind knows. So when you saw that new thing on that label, you're like, wait, hold up. And it had people really thinking about, business really thinking about what they're putting in their food. So that's some amazing daily practical things that you're doing. So that's fantastic. Minerva, so tell us more about what you and your organization are doing in this food as medicine space.
Yes. So we're doing a lot at a very high level. So I'll start with the fact that we know that food security is the basis of nutrition security, and food security is prevention, right? And unfortunately, we have seen a spike in food insecurity. In the most recent USDA report in 2022, we saw food insecurity increase for all demographics. And unfortunately, we do know, and Feeding America just recently put out a report called Mapping the Meal Gap, that food insecurity exists in every county in the country. So there is no place that isn't touched by food insecurity. So first and foremost, we're working to protect and strengthen federal nutrition programs to make sure that there is a strong safety net for food security and for nutrition. And so that is probably where we're spending a lot of time right now. And I'm sure we'll talk about the Farm Bill later, doing a lot of work around that. The other thing that we're doing is really bringing together the partners to make sure that knowledge around food as medicine is spread, whether that's from nutrition, the most basic nutrition education, screening and referral, to higher level activities such as food assistance models like produce prescription and medically tailored meals, to changing the environment to make the healthier choice the available choice, because it's more readily available, more affordable. So we're working with partners across that spectrum who are really experts in the food as medicine space to get that knowledge out into the community and make sure that people are engaged in food as medicine.
Yeah, multi-level, doing things that are practical, but things that are also higher, more grand, and we'll talk more about that a little bit later. And also, when we talk about it later, also feel free to talk more about other partnerships that you have. William, why don't you tell us what you're doing in that space?
Yeah, so the Congresswoman has long been a leader in terms of health equity and access to healthcare. And so she's got a really strong interest in healthcare, but we've really seen nutrition as being, like Minerva said, sort of the fundamental aspect of good health. Good food, leads to good health outcomes. And so she has previously introduced the Medical Nutrition Therapy Act, which I know you touched on in your opening remarks. And so that would expand the access for Medicare beneficiaries to registered dietitians and nutritionists, and would expand the number of conditions that you could be referred for. And so that's one area where we're trying to tackle this issue by giving people greater access to the providers. And then we're happy to co-lead a letter during the appropriation cycle this year with Congressman McGovern and Congressman Buchanan, as well as some others, Rep. Pingree, Rep. Barbara Lee, on a whole host of nutrition, food as medicine issues, medically tailored meals. And so trying to get as much funding as we can for some of our existing programs, try to make some tweaks to expand access to some newer programs. And then we also we have a draft bill that we're calling the Food for Health Act. So fueling optimal outcomes through diet for Health Act. And that's a pilot program that would take USDA and HHS to build out food as medicine programs with community-based organizations and healthcare providers. And we see that as sort of a broad push to advance these issues. Some folks are focused more on one specific issue or the other, but we really want to keep it broad. So medically tailored meals, like Minerva said, produce prescriptions, on-site food pantries, even culinary education, nutrition education, showing folks, once they have access to the food, because obviously that's a huge challenge. How can you prepare healthy meals? How can we help support them there? And so those are some of the things we're working on, and we're glad to continue working with stakeholders like everyone on this call to try to advance some of these.
I like that, this continued theme of multi-pronged effect of how to get to this from multiple ways, multiple pathways. So nice work on the Robin Kelly office. So I do see your questions in the chat, so keep putting them up there because we will get to our question and answer section soon. I do want to ask our panelists another round of questions before we do that though. At the Spring Brain Trust, our theme was, we have the data, now what? So I would love you all to share a data point that you all have done in your organization, and what that data point means and what you're doing with it. So you have this data, now what are you doing with it? And so we'll switch it up a little bit. We'll start with William first with this one, and then we'll move back through our panelists.
Sure, yeah. A data point that we've been using in sort of our outreach to other offices is that we spend nearly $173 billion on healthcare for just obesity alone, and nearly $1.1 trillion for all diet-related diseases. And we like to talk about these issues, especially surrounding food as medicine, when we're meeting with folks on the other side of the aisle, Republican offices. It's one thing I think everyone inherently knows, that nutrition is important to health, but the way we try to talk about the importance of building out these programs and expanding access is through cost savings a lot of times. One way or the other, the government's going to have to spend money to try to tackle some of the diet-related disease burden. And we think if we can invest upfront in some of these programs that we'll talk about today, then we can ultimately reduce the healthcare costs that will contribute later. And so that's a point that we like to use really when we're trying to negotiate with Republicans and hopefully gather their support for some of our bills.
Minerva, would you like to go next?
And I think my data point fits nicely with the point William was making. So we've been really talking about the importance of strengthening these programs, making sure federal nutrition programs are fully funded, that they're really behaving and doing what they're supposed to do. And the data point that I want to share with you is about WIC. And when the fruit and vegetable benefit was first added to WIC food packages, the healthier option contributed to a 9% decline in childhood obesity for WIC enrolled toddlers. So it really shows the strength of being able to make large scale change through these federal nutrition programs, and we really should be thinking of them as preventative programs and investing in them more. And we are so thrilled to see that USDA recently updated their WIC food package, and they made an enhanced fruit and vegetable benefit a permanent part of the package. So we are looking forward to seeing what the impacts of that will be, and we know it's going to be really positive for families that rely on that benefit.
And Laura, I know you're ready to weigh in, so.
Well, and some of my stats actually that we use a lot are a combination of both what William and Minerva shared. I mean, we talk a lot about how diet-related diseases are the leading cause of death and disability in the US, and that contributes to the enormous healthcare spending that we see in the US. So we are at FDA investing as much as we can into nutrition. We see a massive return of investment on our nutrition work. For every dollar that we invest in nutrition, we see $119 nutrition-related public health benefit coming back. So we know that we can be doing more here with the work that we have. So we have a lot going on. I know I mentioned healthy. We have some front of pack labeling work coming up the pike. We are working on sodium reduction. But one of the things that's really important is making sure that people are aware of how to use nutrition labels and read labels. So a lot of people actually really value their doctor as the #1 trusted source for nutrition. So we have been doing more to ensure, and yes, and I see some chuckles, and because doctors don't always get nutrition education, they really don't. And so we've been working to provide more materials that are available for healthcare educators, as well as physicians, pediatricians as well. we have some free continuing medical education videos that are available on our website that we did in collaboration with the AMA and AAP. So we are really focused on making sure that we can provide resources to physicians and healthcare professionals so they can help educate their patients about how to use labels in a quick and easy way to make those healthier, to identify those healthier choices.
I'm glad you asked that, you put that into your answer, because we did have a question from the audience that asked just that. But she had another point that I want to bring up, so I'll just fold that in before we go to our next question. Janet Williams from the AMA asked, how do you recommend a busy primary care physician to engage in food as medicine? And you started answering that already, Laura, with education about nutrition. But then the second question was, are the regulatory and legislative actions that could support PCPs in these efforts, or would support health systems to support their clinical providers? Anybody want to weigh in more on that question about like this legislative or regulatory support for PCPs? Or also, PCP stands for primary care provider or physician. That could be family medicine, internal medicine, or pediatrics.
I can jump in first, but I wish we had Carrie from Food and Friends again, because we really appreciate their model and how they sort of view food as medicine and some of these nutrition efforts. And she could speak to it better, but we sort of focused our draft legislation on that, trying to get healthcare providers to engage with the community-based organizations to then implement these programs. And so I think utilizing the providers, when you all are seeing patients that are struggling with a diet-related disease, or could benefit from a produce prescription or medically tailored meals or something like that, just being aware of some of the organizations that are doing the work now, I think that can be so important. And I know Food and Friends, we had met with them in the past and we toured their location in DC, seeing how they partner with healthcare providers in the surrounding DC, DMV area, and then the healthcare providers refer patients to them to then get the service. And I think utilizing programs like that, where it's a collaboration between healthcare provider and community-based organization, is something we're really interested in. But I definitely agree. I think we could probably do more to sort of help out the providers in that space.
William, that's perfect. So Laura answered the first part, you answered the second part, and then I'll just take it home with being a family medicine physician who sees patients and trains residents and medical students. We just need to know the information. Give us nutrition education, give us the partners. Full disclosure, I also teach a community-based learning course from my medical school, and it's important for trainees to know that partnering with community organizations, people who do this every single day, is the key. And knowing that, making sure that our patients know what is available to them in their community. And so thank you all for the work that you're doing in that space. And Janet, thank you so much for that question. It was very appropriate for this discussion. I want to move on to ask each of you a specific question about your organization. And Minerva, in your intro, you mentioned thought leadership, which is, a term you hear all the time. Want to know more about what your organization is doing in the food as medicine space when it comes to being a thought leader and penetrating our communities with thought leadership in this space.
Thank you for the question. And first, our alliance is a multi-sector alliance. So we have healthcare, health insurance companies, healthcare institutions, as well as other corporations, foundations, universities, and nonprofits, faith networks of all kinds. So we have a tremendous reach in terms of our alliance. And when I started at the Alliance 9 years ago, and one of the things that attracted me to work there is that they were talking about hunger as a health issue. And they were making the connections between nutrition and health. And they had already started a series of regional convenings. And this was led by ProMedica, which is a healthcare institution out of Ohio that's done a lot of foundational work around food as medicine. And they, with the Alliance, with USDA, we're doing regional convenings to talk about the connections between hunger and health, the importance of nutrition in impacting diet-related diseases. And so a lot of that foundational work really has led to what is now the Food as Medicine movement. And in addition, ProMedica and AARP went on to create a nonprofit called the Root Cause Coalition, which looks at the social determinants of health, and they are also a member of the Alliance. So there's that, very sort of initial pioneering work that was done at the Alliance. Again, I can't take credit. That was underway when I started, but we've continued that tradition. So for example, just last month, as I said, we have a national network and a state-based network. We had 2 regional convenings in the last 2 months in the Northeast and in the Midwest, where we brought together partners, including health insurance companies and other health companies, to talk to our nonprofit partners about starting Food as Medicine initiatives and to answer their questions and to talk to them about what they're already doing. And some of the things that came out of that is that there's a lot of activity in the nutrition education and the screening and the referral space. And there are a number of produce prescription, medically tailored meals and on-site food pantries within the network. But there are some challenges in starting these programs. Like where do you get the entry? Where do you get all of the partners together that are needed to support this? This is, the kind of work that takes lots of partners and expertise. And so that is a continuing challenge to really scale up these initiatives and get them really deep into communities nationwide. So I'm thrilled to hear William talk a little bit about the USDA and HHS, proposal to work in collaboration to, encourage more of these kinds of Food as Medicine projects. But just to give you one example of one of the projects that I heard that started during the pandemic, which I really love, is Communicare out in California. They started a garden, next to their clinic. And it was an opportunity. I love this because they brought the community out to be part of volunteering at the garden, along with the healthcare providers and the nonprofits. And they have, really grown that garden. That garden provides fresh fruits and vegetables to the patients at the health clinic. And the health clinic has really deepened their relationships with the community, has strengthened their screening and referral programs. So they just built the act of building this garden and making it part of the healthcare services has really brought in the community, I think, in a beautiful way. So that's just one example of some work that's happening.
Gardening is always a good way to bring the community together. Here in DC, we do that everywhere, right? You have community gardens in most of your neighborhoods or high schools, or some of your middle schools have started either neighborhood gardening, but bringing the healthcare aspect to it and making it folks see the connection, I think, is important. And to your point, there are programs out there, but how do we leverage them and get them in everyone's thought consciousness about what food as medicine looks like? So I'm glad you are doing that work. I do want to ask Laura a question about, you mentioned food labels earlier. You mentioned educating our clinicians. What are you all doing in general health literacy for the consumer?
This is such a great question and such an important issue. So I think the best way to sort of capture this is, the nutrition facts label on packaged foods is widely used by a variety of people. People often say how beneficial and helpful it is for identifying healthier foods, but we know that not all groups use the nutrition facts label to the same degree, including those with lower incomes or education. So that's where some of our work around claims and symbols can be really valuable. They can be quick signals to people to help them identify those healthier foods more easily. That is really central to the work that we are doing on the healthy claim, as well as our work on front of pack labeling. We've seen with the research that they can be particularly helpful for people who have less knowledge around nutrition or health. One of the things that we're doing with the healthy claim is we're actually looking to develop a symbol that would visually depict the claim. So it wouldn't just be text-based, but some sort of logo, some sort that manufacturers could use on their products. This can be also, along with those who may have lower nutrition knowledge, this can be really helpful for people whose first language isn't English. So that is some of the big tools that we are thinking about right now, is how we can provide that information quickly and easily on the front of packages to make people, so people can make quicker decisions. We know people are very busy when they go grocery shopping, and there are times where you may be overwhelmed with a number of choices when you're walking down a grocery aisle.
Thank you so much for that. And so we have what you can do as an individual, know more about, look for this new symbol that's coming out, thought leadership around what you're doing individually, but also in your communities and at higher levels. But we can't do any of this without legislation. We talked a little bit about legislation earlier, but William, I would love to hear about any of the bills that you all are working on, that you're moving through the House, and how we can support them or learn more about them.
Yeah, so yeah, we did the appropriations letter to try to get funding, so we're going to continue kind of pushing on that route. The farm bill has passed out of the House committee, and there's obviously, at least from our perspective, a lot of concerns with that, but we're really interested in what that bill should be and could be. You know, the Congresswoman has over 2,000 farms in her district, and we have a very diverse district that encompasses the south side of Chicago, as well as a lot of central Illinois. So we sort of see the rural, suburban, and urban angle to these issues. So yeah, the Medical Nutrition Therapy Act, that is HR 6407. That's a bill that my counterparts who do more of our health-oriented work have led, and we'd led that as a bipartisan bill with Representative Kagan's from Virginia. And so we're still pushing that one, hopeful we can get consideration. And then we are in the process of trying to introduce another bill, which is that USDA HHS pilot, to really try to expand and get some of these programs rolling in a really comprehensive way. And we're hopeful that by getting the programs out the door and getting folks aware of them and get money flowing, that we'll be able to collect more data like we talked about earlier, so that we can see the effectiveness of some of these programs in addressing diet-related diseases. And so that one, we hopefully will have good news for you soon. We're just still trying to polish off a few things with it, trying to find a Republican co-lead. We'd really love to make it a bipartisan effort, having some good conversations with folks on the other side. And so we're hopeful that we'll be able to share that soon.
All right, and make sure that before this call ends, you tell us how we can support you in that effort, right? You can't push it through all by yourself, so just making sure that folks are active and want to be activated in that way. Some people just want to learn and marinate on the information, and some want something to do. So just think about what they can do to help you, William, and before we end, you can talk about more about that. Minerva, I know you want to weigh in a bit about the farm bill, about the things that you feel like can be improved, but there are some thoughts that you had as well that you want to share.
Absolutely. And the Farm Bill is this behemoth piece of legislation. So I'm only going to focus on one sliver of it, which is access to SNAP, so the Supplemental Nutrition Assistance Program. But first, a little context. I mentioned before that food insecurity has been on the rise and peaked in 2022. Just the last year we have data from USDA. And currently we have almost 44 million people in the US who are food insecure, including 13 million children. So that is a huge number. And SNAP supports about 41 to 42 million in terms of getting a grocery benefit to those households to be able to afford needed food. And so the importance of SNAP cannot be understated. SNAP also has very proven long-term significant positive health impacts, particularly for children who are on SNAP as they get older. So we know that this is an important and proven federal program. Unfortunately, we do have a farm bill out of the House, which is looking to cut back the SNAP benefit in future years. And there's a lot of technical language around that. If you hear thrifty food plan reevaluation, that's what they're talking about. I won't go there for folks, but we're just very concerned that that's moving in the wrong direction. As I said before, we need to be investing more, but at the very least, do no harm. So let's start with the premise of do no harm. And I'm sure folks in the medical field are very familiar with that. But let's, make sure that we're doing no harm to these federal nutrition programs. If anything, we should be investing in them as a nutrition security, foundation. Thank you.
Thank you. We had a question about how close do we think we are to having prescriptions available to write for patients, such as in a preventative process. For example, a prescription for peanut butter for an infant for early introduction to avoid peanut allergies. Do you all think that there will be any legislation or anything regulatory to support that being something that is like a federal or state process? Is that in any of the bills that we're talking about, or not?
Well, I'll just jump in. Yeah, we haven't fully considered that, but I think it is kind of an interesting concept. I think a lot of what our challenge is here in Congress is trying to get the data and get enough of it so that we can go ahead and draft legislation that would increase funding or create new programs, things like that. But definitely happy to look into that issue a little bit more and could connect offline.
Good. And so for those of you who haven't noticed, is now I'm taking questions. So if you have questions that you want us to ask, feel free to put it in the Q&A area. I do, there was a question earlier, but I was waiting for the right time to kind of bring it up. So I'm gonna bring it up now, and it's specifically for the FDA. And Laura is asking, when do we move away from voluntary action for industry to mandatory? Because there are industries that are going to continue to target our neighborhoods and communities with mixed messages. Do you have any thoughts or concerns, or anything you can add or to that question?
Definitely. So I think we do take a mixed approach in some mandatory and some voluntary. So the nutrition facts label, of course, is mandatory on packaged goods. The work we are doing on front of pack labeling is we are working on a proposed rule, which, if you all aren't familiar with front of pack labeling, it's often used to provide quick and easy to understand nutrition information about a product on the front of a package. The front of pack schemes, there's a wide variety of different types of front of pack schemes. So they've been used all around the world. We have been doing a ton of research to understand what type of scheme would be most helpful for people in the US, but some of the research we're seeing is that it can be really the most effective and helpful for consumers is simple and interpretive front of pack labeling. So we are very closely looking at the research, conducting some of our own, and we are planning to issue a proposed rule later this year that would include mandatory front of pack labeling. So we do, of course, do look at some mandatory approaches. Healthy is a voluntary claim, but once that claim does get finalized, we are going to be very focused on increasing adoption and use of the claim, working with our stakeholders on how we can do that. We also have work in the sodium reduction space. We have voluntary reduction targets. So these are targets that we have provided for the food industry to help them slowly reduce the amount of sodium in the food supply. So this is actually one of the most influential ways that we can help sort of create healthier default choices without people even really noticing. And so we have taken a voluntary approach there. It follows a very similar model to what the UK and Canada have done and have been very successful with. We have heard sort of just generally from members of the industry that our targets do provide a really helpful benchmark for them in terms of setting goals and reformulating and developing new products. All options are always on the table for us, but the voluntary approach really has been successful so far. And as I said, in other countries, we are starting to assess the data of the targets that we initially set in 2021 to see how the progress is going. And the data is very early. There's a lag in data, unfortunately. But what we are seeing is encouraging to us. So we do see that there's benefit in having a mix of mandatory and voluntary approaches. In terms of targeting specific communities, I will just sort of note that Obviously, health and nutrition is very multifactorial, and there's lots of different issues that come into play with access and affordability of foods, of course, marketing of foods. We are obviously, our levers are very focused in the labeling space. But of course, there are other folks in the federal government that do play into this as well. And marketing really falls directly into the area of the Federal Trade Commission. So just wanted to note that as well, that yes, we are doing all that we can in our space, but there are some aspects that we're limited in, but there's other federal entities that do have levers in that space.
Fantastic. Thank you so much for that, Laura. There's a quick question. I think, Minerva, you're the best to answer this. It was asking specifically why with SNAP you cannot get hot foods at the grocery stores.
As to why, I'm happy to take an educated guess, which is when this SNAP was first introduced, or formerly the food stamp program, Congress really wanted to make a distinction between a grocery benefit and a benefit that could be used, for example, at a restaurant for hot foods, right? And so, and remember when SNAP first got introduced, it wasn't a big thing to have hot foods in supermarkets, right? So they kind of made this distinction, between the, refrigerated food that you take home and you prepare. And so also the idea was, folks would be spending a lot of time shopping, preparing food, and eating together as a family. We've updated those assumptions. USDA, when they reevaluated and in 2022 increased the SNAP benefit, one of the changed assumptions they made was that instead of spending more than 1 hour on food prep, the average family spends about 35 minutes on food prep per day. So I would guess that's the why, but there is a solution here. Representative Ming out of New York has promoted a bill that would make hot and prepared food at supermarkets available for SNAP benefits. That's something that we absolutely support and advocate for. We want as much flexibility when that family enters the supermarket for them to decide what makes sense for them in terms of how much time they have to prepare food and what they prefer. And, I know in my supermarket, I always go for the rotisserie chicken, and it's really not a big price difference between that and the chicken in the refrigerated section that would take me, 2 hours to prepare at home. So I think it's a great question, because we are looking to have more flexibility and agency for families on SNAP to make decisions in the grocery store.
And I want to position too. You want to consider that, yes, you're mentioning rotisserie chicken, but next to that is the fried chicken and the barbecue chicken and the sausage and the things that have way more sodium than I would want my patient to have as a provider. And so as a physician, so just thinking through as well, we name that one thing, but when you prepare your own meals, you measure how much salt you put in it. You measure how much in a grocery store. You have no idea how much of a oil or salt that they use to prepare that meal. And so they probably will go towards making some of that available, but also being mindful, practice wise, when you prepare your own meals, you're going to make it just a little more healthier than someone who wants to just make it taste good. So that's just my little 2 cents as a physician. I did want to, William, you were about to say something and I interrupted you. What were you? Go ahead and add what you want to add.
No, you're fine. I was just going to chime in on kind of the prepared meals. And there's also a program called the Restaurant Meals Program for a certain eligibility within SNAP for folks who are disabled, elderly. And Illinois is a state that has opted into that. And so that can provide SNAP specific meals that they can go to a restaurant and utilize their benefits there. And I think there's some interesting creative ideas, and we've been in conversations with folks to potentially expand that program. And also I think it's hard with the SNAP angle, because we don't, like Minerva, I think can touch on it better than I can, but we obviously don't want to restrict folks, even though we do want nutrition to be incentivized in some cases. I don't think we want to restrict access to folks. But I know there are some ideas in there to give people a little more autonomy in how to utilize their benefits. And so I think we'll see more of that in the next handful of years. And if we can do that in a way that also prioritizes nutrition as well, I think that'll be great.
Great. So we got a couple more questions in the Q&A, so I'll take a couple more and then we'll wrap up. So the ones that are there that I think we should definitely give some time to is, we have one that says someone who was in the food as medicine program in Atlanta noticed a lot of issues regarding food as medicine is the language that exists around plant forward feeding. In what ways do you think proper health communication can be used in legislation and program development so that the public can be more welcome to programs like food as medicine? Also, nutrition epidemiology research is fairly new field and many don't know about it. In what ways do public health experts plan on raising awareness regarding this field? Anybody want to take a stab at that question? The first,
Yeah, I can.
Go ahead, William.
Okay. I think in terms of like deciding, which types of foods folks should be eating, I think that's what a lot of the work around medically tailored meals is doing. Because it obviously we want folks to eat more fruits and vegetables, but I also think they could eat lean protein, and it could be just about reducing sodium intake and things like that. So I think that's where those conversations between the provider and then the folks implementing these programs are where they're so important, because whether it's for cultural reasons or nutrition reasons, folks will have foods they won't eat, foods they will eat. And so I think it's really important to make sure we're sensitive to that, and try to move forward with nutrition and what makes sense for someone's overall health, and as well as, what works within their lifestyle.
Right. And as far as labeling, what regulations beyond labeling, such as fast food and restaurants, begin incorporating towards food as medicine? Do we know or have heard anything about that, or have seen anything in our spaces when it comes to fast foods and restaurants?
I can start off just by talking a little bit about what FDA is doing with restaurants. So the voluntary sodium reduction targets that I mentioned earlier does include targets for restaurants. So that is one big aspect that we are looking at. Is not just the foods that people are purchasing in grocery stores, but how we can reduce the amount of sodium in foods that people may be purchasing at fast food, restaurants, etc. The other piece is our menu labeling work. So the Affordable Care Act provided us with the authority to require labeling, calorie labeling in particular, on menu boards for chain restaurants. So that has now been enacted. If you go to a chain store, you will likely see calories declared next to the menu items. That regulation also requires that restaurants have on hand and on site additional nutrition information. So if a customer wanted to request more information about the various menu items, they can do that, and it would have information about the sodium content, the calories, which are also on the menu, fat, things like that. So there are ways to get more information as well. So those are the two aspects that we have been really focused on. I will just note that this is a huge area that I think is really important, because we know that almost half of what people eat comes from restaurants.
Mm-hmm. There was a question that Minerva typed an answer to, but I think it's important to bring up live, is it was asking about administration using bringing breastfeeding up as a first food, like there's a focus on breastfeeding as the starter food. Is this the case in this administration? I think the better answer is this a question when it comes to food as medicine? Is that a part of food as medicine when you think about it? Is that's been something that has been connected to legislation for food as medicine? If FDA is thinking about breastfeeding as food as medicine, as a provider that does perinatal care and prenatal care, it's important to me to think about that as well, because that's always the first food that I suggest my mothers give and birthing people give their newborn. So do we know if that has been connected to any legislation or any of the activities that your programs are doing? Even as a thought, because you talked about thought leadership in this space, has it been connected? Anybody have any thoughts about that? Anything at the FDA? Any legislation connecting it? I know that Dr. Robin Kelly has the Mom Act and a lot within Black maternal health. Have there been a connection between food as medicine and maternity care?
Yeah, I don't think we've directly addressed that issue, but my health counterparts lead all the Congresswoman's maternal health work. And if you want to connect with me, I'd be glad to refer you over to them and get their thoughts on it.
So that's why I love these webinars, because we have such smart people who bring up such great things that they could do. So it sounds like, family, this is a place where you can get active in making that connection for industry, for doctors, for corporate organizations to connect food as medicine to maternal health, because it is a starter food. So I love that that question came up, and it's something that there's space for thought leadership, there's space for health communication, there's space for folks making that connection for our legislators and our businesses. So on that note, we will go ahead and wrap up today's webinar. And so if each of you if you have any final thoughts or final messages that you want to leave our audience about food as medicine as it pertains to what you do or what you just think needs to be out there. And so I'll start with you, William, and then we'll go through to Minerva and then Laura.
Yeah, well, I'm really glad I got to participate in this conversation. I think we are sort of newer to the food as medicine space, but like I said, the Congresswoman really cares a lot about health, access and equity and nutrition as a whole. And so, yeah, we are looking forward to continuing to engage with everyone in this space. I think it's really important. It's really exciting. HHS, has done a summit. The White House held the conference on hunger and nutrition. There's a lot of momentum here. And so hopefully we're able to kind of roll that forward and advance some of these bills and as well as get additional funding for the programs that we know work as we move forward. And I appreciate everyone's interest in this topic. And hopefully, we can count on you to from your organizational, ability to put a little advocacy towards other members of Congress and get them to consider these things when we're talking about passing legislation.
Minerva, any final thoughts?
Yes, food as medicine is such an important and growing field, and I'm so excited. I was just at a conference last week where there was a food as medicine session, and I think there must have been at least 300 people there, whereas when we first started this work, maybe there would have been 25. So this is a field that's growing, and we need to find ways to continue to spread good information about what works and get people engaged and scale up initiatives. For us at the Alliance, we know that federal nutrition programs play that important preventative function in terms of health. And so we also know that when we make the healthy choice, the affordable choice, and the available choice, that families will always, always, always take advantage of it because they want those choices. And it's really a resource issue that's preventing a lot of improvement in this area. So we want to continue to advocate on that and just really appreciate everyone's time and interest today. Thank you.
And Laura?
Yes. Well, I will just say that I think we obviously have worked a lot with various consumer public health groups. We work regularly with industry, and we really do want to get more engaged with the healthcare side. So get involved, reach out to us. As I said, we have free continuing medical education programs that you can take on our website. This is a great way for you to get more familiar with the work that we are doing in the nutrition space. It's a great way to start engaging more with your patients about nutrition and how to use the label to make those healthier choices. But this is very similar to what William was saying, that greater engagement from the clinical community, physicians, nurses, dietitians is really essential in helping these and other nutrition initiatives reach their full potential. So get engaged, use your voice, and we hope to hear from you.
All right, there you go. Get engaged, use your voice, and we hope to hear from you. Thank you so much for joining us. Thank you to our amazing panelists for being here and lending your voice in. Thank you for all that you do. Everyone, enjoy the rest of your weekend. Happy Father's Day to those who are fathers. You're probably a father of something, a plant, a fur animal, a human, any way that you feel that role for in the universe, you are blessed. So happy Father's Day to everyone, and everybody have a great weekend. Thank you, everyone.
Thank you.